Making First Nations clients comfortable in a modern medical setting is a challenge in promoting the health of First Nations people, particularly when dealing with elders who are not accustomed to modern medical practices. Lani Mitchell, a nurse practitioner who works at the Gishwatiziwin Health Access Center, explains how she makes her clients feel more comfortable when dealing with their health.
Health professionals have to recognize that you have to be on the same level as the patient. You can't have that authoritative, health practitioner-patient relationship that was sort of old school. I say and the patient does. It's a combined effort. And I think with First Nations people, if they recognize that the healthcare provider cares and knows that they have the responsibility to take care of their own health, it's not put on the healthcare provider, then that's going to be a big key.
Donna Hayes, a registered nurse who has been at the Health Access Center since its inception, explains that understanding Aboriginal history and culture as a health professional will go a long way in treating Aboriginal patients.
As with any culture, you have to have an understanding of the education level of the people. Do they understand English? Do they only speak their own language? Do they know the terminology? I know a lot of people come in here and they've been at an emergency department. They don't understand what they were told. And I said, it's so easy to say something simple in a term that we all can understand. You don't have to use the medical terminology. That's uncalled for. And a lot of times you can draw pictures, and just explain to them, this is how this works. Or put in perspective to say, the motor in your car, this is how yours works.
Proper interaction with patients in the examination room is key in obtaining the client's trust and sustaining a comfortable environment, and can be obtained by using very simple techniques.
Going to the door, having them come in. I never use Mr. or Mrs. I don't feel comfortable. I'm First Nations. I don't feel comfortable with people calling me Mrs. Mitchell. So I always use first names, and it's not disrespectful, it's just more personal. Try to give the person that space that they need, the personal space, not getting too close. I don't use a lot of medical jargon, just language that they can understand.
You'll find some of the teenagers that come from the more remote reserves that are a little shy and don't want to ask questions. So I just kind of try and joke with them, and then you get them laughing, and then, go ahead and tell me what it is. It's like, if it's a female, tell them we're all the same, we're females, this is not going to go any further than you and I.
I think one of the ways that you make clients feel comfortable in a First Nations community, humor is a big, big issue. You have to use humor, you have to laugh, you have to, because that's what makes people feel comfortable. Back at home, whenever there's a birthday, people are laughing. Whenever there's a wake, people are laughing. It's a way that we deal with our emotions. It's an expression, and you need to promote that in a clinic, in a healthcare setting.